Welcome to Sage Women, the podcast for midlife ladies navigating perimenopause, menopause, and healthy aging. I'm Melanie White, and each week I talk with experts and women sharing real stories, practical insights, and smart tips to thrive through this stage of life and beyond. Welcome again to the Sage Women podcast. I'm really pleased to be here with Shannan White today, talking about some of the unique health challenges that women face in regional areas. And Shannan and I are down the road from each other on Zoom in a regional area in New South Wales. So we're right in the thick of it. And we'll be talking a little bit about what sorts of services women need, maybe how to get some better care in both allied health and physical activity in particular. And bridging some of the gaps between what women experience in regional versus rural areas. Shannan, welcome and thanks for being here.
Thanks very much for having me, Melanie. So I guess I should start with actually introducing myself and what I do. So I'm an exercise physiologist and exercise scientist. I predominantly work in managing health conditions and injuries, but I'm really, really passionate about changing the experience of women in healthcare in a regional perspective. I do this both professionally and personally. Professionally, I do it through working with the women in the clinic, and personally, I do it through changing the access to information and education in regional sporting teams. So predominantly, I work with the women's team, but also the junior teams coming up as well, to kind of change that awareness and access to information about how to exercise for women.
That's amazing. Shannan, are you a Broulee local? Did you grow up here or are you from elsewhere?
No, I'm actually from Melbourne originally. So sort of looking for a opportunity when I was younger to move to an area and be involved in community-based health initiatives essentially. So I went north first, and then I've just kind of worked my way down the coast. I really just love having a balance in my life about having the coast and the country as well, and access to a lot of different sports, which is what sort of brought me to Broulee.
Amazing. So a lot of experience on the road by the sound of things. And I'm really interested in what got you interested in exercise physiology in the first place, like your profession.
Um, in general, what actually happened is was really lucky, and I spent a lot of time with my grandparents growing up. And they're involved in a lot of health initiatives. And so I went to a talk with my nan on the use of prosthetic limbs in war veterans when I was maybe 11 or 12.
Wow.
And that was it. I decided that that's what I wanted to do. I've definitely moved away from that being my area of focus once I got to university and actually started studying. But that's essentially where I actually started.
It sounds like they were really inspiring for you, doing a lot for the community with regard to sport and exercise, and maybe seeing a place for yourself in that area.
Yeah, I think I'm quite lucky. Quite a lot of my aunts and uncles are actually involved in medical professions in varying environments, from general practitioners to physios, nurses. There's quite a diverse health background. And I think just growing up around those conversations from a medical side of things, but actually just growing up in a sporting family and having those conversations being dinner table discussion, it just kind of brings both of those things together, I think.
Wow, yeah, like a perfect storm. I'm curious to know what sports you play or get involved in.
AFL, actually.
Yeah. The real footy, yeah.
Yeah, and it's become quite a passion of mine. Is actually developing and writing the running and pre-season programming for both our club, and I have a few other clubs across Victoria that have actually started doing it as well. And having a women's specific training program that's inclusive. I think one of the greatest barriers for all age groups to exercise is where to start, particularly for women. Essentially, sometimes there's barriers to being a junior. You're not having the access to sporting teams. This is changing, but for a lot of women starting sport in their later years, it can be really confronting coming into something and not having the background or not feeling like you're fit enough to start. So I really have had a focus on trying to make that really inclusive and saying to everyone that comes along, whether they've done it before or not, you are going to be able to do this if you just bear with me and trust me a little bit. And it's something that a couple of the girls who, like myself, are not maybe runners, have really enjoyed doing. And it's been really nice to see everyone challenged, but also everyone progressing.
That's amazing. It must be challenging to make a sport inclusive of all abilities in a small country town and maybe with a wide spectrum of abilities in a team. How do you accommodate different levels of ability in a program?
Um, it actually is something that I think both professionally and personally, it's probably one of the biggest things I see as barriers for women in exercise, regardless of whether it's in the gym space or on the sporting field, is figuring out how to use each individual's skill set. So sometimes I think we come at it from a perspective of what are they lacking, whereas I think it needs to come from a perspective of, okay, but what can you do? Where do we start? What's something that you do really well? It's funny, you notice things like some of the mums, their attention to detail, they pick up little things across the field and they're more aware of things because they're so used to chasing after two kids. Or, it's using a skill set that they might already have rather than trying to teach them how to do it as a footy player. It's teaching them how to do it from a skill set that they already have. And for me, that's where we promote confidence and improvement in ability is start with something people already know how to do and use that to their advantage rather than trying to fit them into a mold like we might have done in the past.
Oh, I love this conversation so far, Shannon. It's so important. And last week I was speaking to Dr. Paul Batman about barriers to exercise and how do we get more people exercising. He's in Queensland and he said, we've got these exercise guidelines and most people don't even meet them. And perhaps we shouldn't be talking so much about guidelines as to where to start and helping people actually maybe who are sedentary just take the first steps and even celebrate that accomplishment and make it easy for them to start rather than expecting them to immediately meet exercise guidelines that might feel like a huge stretch.
Yeah, I think when you put it into perspective, it's 150 minutes of moderate exercise or 75 minutes of vigorous exercise. And some mums don't even have enough time to brush their hair. So I think that for a lot of women in particular, when we put that ceiling on something, it actually sets the bar for failure from the get-go. It makes it almost unattainable. And I think that's the thing is when you don't know where to start and the information that you're presented with is almost overwhelming, that actually becomes a barrier in itself. It's almost like you need to do X, Y, and Z, but where do we actually start and how do we get there? For me, with women, the more important thing is do you enjoy it? Are you actually going to do the exercise rather than you actually do need to do 2 resistance sessions? And what that looks like for each individual could be completely different depending on where they start.
Yeah, so interesting. And I'm wondering if for rural communities that team sport makes it easier to start exercise because there is a community feel, there's a social element to it. I'd love to hear your thoughts on that or any other strategies that help rural women particularly to be more active.
I think it is. Generally speaking, I would say both in the clinic and in the sporting environment, it's you end up bringing a friend along. And I think that's where that community comes from. I see it in the gym with a lot of the women, particularly in programs that we've started or been running, is it's word of mouth. It's, if you know a friend that's been in the gym, they're more likely to actually come in the door. I would say subjectively, that's probably where we would get more of our referrals, I would say, than maybe the internet or doctors. They do come from there. But I would say general retention into actual gym classes or into the sporting environment in community spaces comes from word of mouth. So that the barrier first is coming into that space. But then if you have a good environment, you have a good social connection, you have a good support system, I think they're more likely to start exercise because it becomes less daunting. I think the adage is you can't be what you can't see. So when you can see someone that's of a similar age bracket or similar background to you coming into those environments, they're more likely to feel more comfortable, just based on what I sort of see in those spaces.
Mm. Yeah, really that bringing a friend or that word of mouth thing, I suppose it's especially important in rural areas, regional centres where there is such a strong focus on community and who do you know and it's often that word of mouth referral that'll make or break a business, right?
Yeah. I think we saw that really specifically, particularly when we're talking about women sort of between those ages of 45 upwards. Gyms are not something that they really grew up with. It's not a huge influence. Sometimes we do get women that have been lifting for a while, but it's very rare. So that can be a very, very daunting thing to come into. I think we sort of touched on this when we first spoke, is that for a lot of women, their experiences with exercise are not great. It could
Yeah.
be from school, or it could be from a sporting environment, which old school mentality is, if you're not sweating or crying or vomiting, then you're not working hard enough. Or in a school environment where if you weren't that good at those sports, then that can actually be a barrier that people hang on to because of maybe it's embarrassment, or maybe it was being uncomfortable, or traditionally women's sporting teams don't have sporting equipment that actually suits women. So those experiences can really shape how we then go into exercise later in life. So for me, sometimes that's probably one of the next things that I see as a barrier, is those experiences then shape the likelihood as to whether they're going to want to come in and lift weights because of what they might think about exercise in the past.
Mm. Yeah, that makes sense. And particularly anyone that was growing up in the 80s, was a time of G-string lycra leotards and high impact aerobics and all sorts of crazy things. And I think the unrealistic body image was part of that too. So anyone with those sorts of emotional bookmarks, like you're saying, or bad experience at school, like if you weren't picked for the team, it was a real social blight on you because you weren't good enough to play sport or whatever. It was quite an elitist mentality in some places. So how do we help women get into exercise? I mean, you've talked about they're looking at their strengths and leveraging what they're already doing well and translating that. And you've talked a bit about going with a friend or maybe a community type situation. Is there anything else you think that would help women to take the first step?
Honestly, I think it is just having those conversations and starting those conversations. For women, it is probably addressing things that we may not normally have spoken about in the past. I think the conversation and the topics, they are improving, but unfortunately we still do have a lot of that terminology around exercise. It might have been in the 80s, it was that kind of high impact, tone up kind of exercise. You still see that conversation being present for kids as well. I think we know that if children, both boys and girls, if they are more active and they do more exercise in their younger years, their bone density is much greater when they peak in their 20s to 30s. So if we start that conversation earlier, that does help when we get to later in life. With women that are already there and maybe introducing to exercise, I think it's creating spaces that are a little bit more welcoming and open. Telehealth has actually been quite a really good advancement in access to exercise and education in rural environments. I think exercise programs specifically targeted at women for women to address areas is probably one of the main things, is providing spaces where this information is for you. This information is about what you need and specifically targeted towards the areas that you might want to address for your health and fitness, rather than do these 7 exercises for toned arms. And I think that's probably the thing, is shifting the conversation, having the conversation, but shifting the conversation towards what can our bodies do rather than what do they look like.
Yeah, I love that. What can they do instead of what do they look like? Yeah. That's amazing. In fact, it's interesting, the way I heard about you was I went to a craft group with some of the local ladies. Most of them are a little bit older than me. I'm sure they won't mind me saying that on this podcast. And one of them had been to this fancy dress and she popped out with this outfit on and everyone said, "What's that you're wearing? Is that one of those weighted vests?" And she said, "Oh yeah, that's from that program we're doing in at Broulee." And I'm going, "What? Can you tell us a little bit about, not the fancy dress costume, obviously, but the weighted vest?" How does that work? What is it all about?
Yeah, so that was specifically in relation to a essentially bone density program that we were running in Broulee, which we will be running again. But there is specific exercise programs designed for essentially those that have been diagnosed with osteoporosis or osteopenia, based on research by Dr. Beck, who's quite well known in the field in terms of osteoporosis and bone density and exercise. So we don't have anything like that down on the coast. So myself and another exercise physiologist kind of went, we need something. We need an exercise program that teaches women how to lift and provides a entry point. The weight of vest comes into it in terms of the types of exercise that we want to be involved in. As I sort of touched on before, we reach peak bone mass between the ages of about 20 to 30. And unfortunately, after this, it starts to decline, particularly with the drop in estrogen associated with menopause. It does influence quite a lot of health factors, one of those being peak bone mass. Unfortunately, once we start to drop off in estrogen, it doesn't keep our bone breakdown in check anymore. So we do need resistance exercise. That stress on bones helps with that bone remodeling process. Having that external weight from a weighted vest can help to load the bones and provide a stressor. And it's one example of the type of exercise that we like to include, which is that resistance-based exercise or anything where the bones are under a bit of external stress. And so that's where that one comes from. Is I'm not sure about wearing it to a fancy dress. I can't say I've done that myself, but it's really good to know that the ladies have taken away part of the education, because that's the way that we wrote it. Was we wanted to have some education, have some information about this is actually the type of exercise, this is what you need to do, and then this is how you do it. And then from there, that exercise group has become a new exercise class, which is continued resistance training, following that introduction class, which is pretty successful, and we're looking forward to running it again.
That's really interesting because it sounds like it was a great starting point. And you mentioned starting points and removing the barriers earlier, and now they're progressing to a new level of program, which means they're sticking to it.
Yeah, which has probably been one of the more exciting things. A lot of the women, I think maybe one lady had done strength and conditioning before, and she was one of the younger ladies in the program. But the rest of them hadn't really been involved in any regimented exercise classes before. This was a new thing for them. And to see them go from lifting 4 kilos to, I think one of the ladies was doing maybe a 40 or a 50 kilo deadlift by the end of the program, and it was only 6 weeks.
Wow.
And a lot of it just comes from confidence. The first 1 to 2 weeks of a new exercise program is actually neuromuscular changes. So the brain working out how to move the weight in the way that we're asking it to move, and then just building that strength and confidence in those movement patterns. So that's where a lot of that was probably focused, is these are the types of exercises that we want you to do, and we're going to make sure you can do them safely. As we do know, there are other associated physiological changes that do occur postmenopause and that are associated with risk factors in osteoporosis. And so making sure that we're working on balance exercises, a little bit of cardiovascular exercise, that resistance training as well, doing things safely, and then giving them the confidence to then go into a new gym environment, whether that's with us or going and training at the gym. That's the point of it, is to give them the tools to be able to exercise independently, safely themselves. Because, even myself, I walk into a new gym sometimes, and I've been in gyms for forever, and I still feel a bit like, oh, I'm not quite sure what to do here. And I think removing that as a barrier is probably one of the most important things, I think, is making the awareness that it's okay to not know 100%. It is daunting learning something new as an adult. Typically, the last major skill that we learn is driving, and then maybe we pick up something new as we age. But in terms of movement, it's not super common to be learning something new. So removing that barrier and improving confidence and awareness in movement, and then setting them up with the tools to then be able to go out and do that independently is a really crucial part of continued exercise.
It's amazing work that you're doing, Shannan. I hope that what you're doing can become a model of care for other regional centres, because it sounds like you've really gotten some buy-in and some continuity in exercise, which is great. I'd love to ask you some questions now about some of the sporting stuff that you're doing. And I heard earlier in the year about something called the Z angle, I think it was, with women's knees and
Oh, I was like, oh,
the
I'm not sure. Yes. So
well,
essentially, there is
yeah.
a lot of research going into the angle in relation of the hip and pelvis to the knee. How much of the influence that does have on the risk factors associated with ACL injuries. In particular with women's sports in community levels, it is quite difficult to ascertain good research results because there are so many different factors that influence injuries. So what they're looking at, and one of the reasons that they're looking at this is because that angle in women does place them at slightly higher risk factors of knee injuries, particularly in sports that do involve multiple directional changes. For example, AFL, unfortunately. Soccer is also a really prevalent one. We're seeing a lot of new research going on over in the UK in relation to this. But a lot of that problem comes from training. Are we fit enough to be doing the sports that we're doing? In recreational athletes, a lot of us unfortunately don't train to be athletes. If we go to the gym, we're training to be strong or be fit. Sometimes we're training for what our body image goals are, but we're not training around how can I be an athlete that's prepared to do these sports. Then we have the influence, unfortunately, with women is because of the fluctuation in hormones, we're placed at slightly higher risk factors of injury depending on which part of our period we're actually in. And so part of what I've been working on very slowly and nudging it in the right direction is educating a lot of the girls that I play sports with on the differences in how you might feel and what that might actually influence across the period cycle. So far it's been a bit more of a casual conversation because it is something we don't tend to historically discuss in general conversation. Whereas I've got a little bit more of an approach of, I'll be standing behind one of the cones and going, oh, hey, like, how are you feeling today?
Yeah.
So yeah, that's where a lot of that has kind of evolved in is I started writing a fitness program and a running program that established something that everyone could be involved in order to improve our fitness, because the fitter we are and the more physically prepared we are, the less likely we are to have injuries. And then starting that conversation around where we are in our period cycle, because knowing where you are and how that might influence your injury risk can therefore reduce injury risk. And then we come to things like the angle in relation to our pelvis and knee of can we improve our ability to move and move well and the strength of the muscles in both the knee and the hip, and can that reduce our risk factor? Unfortunately, there are uncontrollable factors like grounds, which maybe aren't fantastic in community level sports, but that's where a lot of that's focused for me, is bringing up that conversation, improving fitness as much as I possibly can across a broad scale, but just starting that conversation with some of the younger girls and some of the older girls as well. We have some athletes that they've only just started playing sport in their late 40s, and that is a bit of a period of time when we're going through quite a lot of changes, and they're some of the strongest athletes in our team, and one of the reasons that they are is because they have started taking on the information from a younger age bracket. They started doing their strength training in their 20s and 30s, and they're some of probably the strongest and fittest athletes that I know. I think actually they did top our preseason testing in our deadlifts, which was really cool.
Wow.
To see the older athletes, which I hope they'll forgive me for saying older athletes, but when the youngest are about 12, unfortunately that is the bracket that we do fall into. But yeah, for me, that's kind of where I've focused. Eventually, I'd like that to be something that I can deliver talks and information to multiple clubs, to start changing that education, that awareness, because if we change the conversation from a young age, we change a lot of those risk factors going forward. If we can bring in some resistance training for our 13 and 14-year-old girls, the likelihood of experiencing osteoporosis is far less. I think the percentage is something like 10 to 13% later in life onset of bone mineral loss versus it occurring much earlier. But it's also the mums, if you can, or dads as well, if you can change what mums and dads are aware of, then we then change that experience for girls in sport and girls in health.
It's so important talking about health across the lifespan. And as you say, we need to think about what's happening in teenage years. I mean, we at Sage are doing some work with IPQ Analytics, which is a US-based company looking at disease as a process, not as an outcome, and what are the things that we can do earlier in life to lower the risk of certain conditions. That's exactly what you're talking about now. What can we do with girls in their teenage years, in their 20s and their 30s to set them up for the best possible experience during and after menopause, which is that accelerated time of biological aging.
Yeah, and I think probably, aside from bone health and, cardiovascular health, one of the other things that does pop up quite frequently is that conversation around continence. We do know that there are associated changes in menopausal women with that change in availability of estrogen and other hormones. And there are changes to the musculoskeletal structure, and there is loss of strength purely associated with that change. But some of those changes are preventable and changeable if we get in there a little bit earlier. That conversation often exists around things like, oh, well, I've had children and therefore this is normal. Or it comes from a place of no conversation is occurring, so I didn't know that it wasn't normal. So if we can get in there and have those conversations as a more readily available topic, we can then change what that experience is later in life, because it is something that controls a lot of women, their day-to-day habits. It changes what they do, how they live their lives. And for me, I think that's where that comes from is, how much can we influence from a younger age bracket? If we talk about these things now, can we influence women's experience in healthcare enough for them to go, oh, hang on, this is not actually normal and this is not what should be happening, then can we improve the outcomes and can we change how people feel being able to ask these questions of their medical practitioners?
Yeah. Yep, I 100% agree is how do we get that conversation going? And I think the work that you're doing really leans into that in the education sessions. Obviously, there needs to be probably some structured public health campaigns as well, but
Yeah.
I love the difference that you're making in our local area, and I hope that we can get more people engaged and involved with what you're doing. I suppose I have one last thing to talk about before we wrap up today, and that's really about some of the considerations for women in midlife, because the backstory to this question is when I studied as a personal trainer a long time ago and then redid my qualifications in 2007 and worked with midlife women for a few years here, we get taught as exercise professionals to deal with the general population a certain way. And then there's when you're an older adult, which is osteoporosis and those sorts of things that have already been established, but there's this gap in the middle, at least there was when I was doing my training, in what do we do with women undergoing significant hormonal fluctuations who have periods of exhaustion, periods of low mood, start to see the onset of musculoskeletal syndrome and all of those sorts of things that now have names that didn't before.
Yeah.
And then we're seeing influencers on Instagram doing heavy deadlifts and going, I should be trying this and that. And they're trying to put training regimes in place, whether or not they've had experience, but they're getting injured or they're feeling like they can't possibly do it. I know it's a big topic, but do you have maybe just a couple of thoughts on where we need to be going in that stage of life and what we need to be thinking about?
I think, unfortunately, like you said, it is quite a big topic, and the answer is, unfortunately, it depends. I think for anyone, it doesn't matter where they are in life, the answer is always the same, is how much exercise are you currently doing and how does that make you feel? From there, it's a matter of then using the information available to then guide those choices and actions that we're taking. A lot of women, if they are already exercising, the information is, I might be doing 5 sessions a week and I'm eating less. And unfortunately, then we're presented with information that makes us feel like we're not doing enough. Influencers sometimes are not helpful in this because it makes it look like we should be doing a lot more exercise than we are. So sometimes the answer isn't actually do more. Sometimes it's how are we doing and what are we doing and how do we feel after it? And then we need to pare that back. With anything, I think the reason that we exist and the reason that I love what I do is that we can help with these answers. So my advice for pretty much everyone is seek out additional help if you're not 100% sure, because that period of time, those fluctuations, and a lot of it is unfortunately because of those changes in hormones, things are happening. Body composition is changing, fatigue levels are changing, and the physical changes to our brains are immense. The changes in estrogen changes how much neurotransmitters are available that are associated with our feel good chemicals. So it actually makes it physically harder, not just from a physical standpoint, but a mental standpoint to exercise. And that can be altogether overwhelming. So it's always, what are we currently doing? How does that make you feel? And what changes do we need to make to help you feel better? And sometimes that's not actually do more. I think as a society, because a lot of that information around exercise is you need to be doing more and you're not doing enough, we don't place as much influence on things like sleep and diet in the right way. It's often, if I'm not losing weight or I'm not feeling better, our first switch is always deprive. It's always eat less, do more exercise, and that should balance things. Whereas that's not always the answer. And I think that the overwhelming availability of information is sometimes not helpful. So seeking someone like an exercise physiologist that can shift that conversation towards the right direction, or put you in the path of people that might have better information, is probably the best answer. That period of time is such a fluctuation and change, and some of it's not controllable. It's not often your fault that you feel like you want to eat more sugar. It's actually a chemical change in the brain, or you might be more fatigued because you're in a period of fluctuation. And helping people understand that and having more control with more information, that's probably the best answer that I can give. Is we need to use that information to help guide our choices rather than it being a barrier to what we're doing.
Yeah, it sounds like it's really all about getting some professional help to make proper adaptations and maybe just revisiting what we're doing. And I suppose really good technique is important too, right? You've got to have that foundation of how do I exercise so that I'm supporting my pelvic floor? How do I exercise so that I'm supporting my bones properly? In light of any emerging risks, there's all of that to consider, right? And I've seen women on forums saying, should I wear this thing or that thing? And I've had an injury from running. Has anyone got any tips on what exercises I should be doing? And I'm jumping in and saying, why don't you go see an exercise professional to help you make a good choice? And someone's going, I bought this from Kmart. And I'm thinking, that foundational technique is so important, and getting the right advice to help you deal with those emerging concerns. Like I saw a clip the other day, I think it was on YouTube, and it was a presentation that someone was doing saying, we need bone strength, and I want everyone to jump up and down on the spot 20 times. And I went, oh, bladder leakage, pelvic floor.
Absolutely. And I think that's the thing is I never want to deter anyone from having the motivation to exercise, but guiding people towards the right types of exercise that's going to be beneficial is the answer. I think unfortunately it's one of those things where traditional response to injury has been rest for 6 weeks and it'll feel better, which we know is not the case. So we've got that mentality and that previous advice then butting up against an overwhelming amount of information from people, which usually well-meaning, coming from that opposite end of the spectrum, is everyone do this exercise and it's going to be helpful. And the answer is most of the time, probably, as long as we then don't have some of these other situations. So for most women, it's about finding the right type of exercise that's going to suit their lifestyle, that they're going to enjoy, and that's not going to make any of your existing symptoms worse, but it's just going to make you more prepared to live and age better in a way that supports health versus sometimes, unfortunately, that access and immediate access to information, it's great. It does mean that we can get advice, but that advice is not always 100% the right thing. I gave a talk recently to a aged care group about maintaining continence, and I spent the whole time talking about how, pelvic floor exercises are great, but a weak pelvic floor is not always the reason that we experience incontinence. There are actually different types. And so the advice to do pelvic floor exercises can actually cause incontinence symptoms. And then one of the ladies piped up and was like, "Oh, well, I bought this pelvic floor trainer off of Shein, and my neighbor told me it was really good." And that's the thing, is it's fantastic that you're trying to do something. It's beautiful that you've got the motivation to make that change. But is that the answer? Probably not. And it's probably not something that I would recommend without knowing what the reasoning is. So I think having the availability of exercise physiologists that are trained, or personal trainers that are trained in these particular areas, is really important, because we don't learn it. As you said, that's not what we learn. We actually have to go and seek this information. So it's going to someone that specializes in these areas to help guide it, because there is a reason that we have different specialties. You don't go and see a plumber to get a Sparky's job. You go and see an exercise physiologist for specific information, because it is so broad and it is so wild, and there are so many different things to sift through, that providing access to the right type of education, the right type of information, is what we do for a reason, because it can be pretty scary. And I think the most important thing going forward for women, and how we can address that kind of gap right in the middle, is we use the information that we have based on the age bracket that you fall into to guide your exercise recommendations to help you move better. Rather than being this scary and overwhelming thing, it becomes information that kind of helps us move better and move well, instead of this barrier. We've got these changes occurring. Okay, how can we use that to help you, rather than it being this problem that's occurring?
I love the way you think, Shannan.
Just thinking, I'm not sure if I actually answered what you asked, but
No, you did. Yeah, you did. I mean, it's really, we're all individuals and we need a personalized approach in order to exercise safely, right? And it might mean adapting what we're doing or to continue what we're doing, but without that kind of guidance, then people are acting from a position of, I don't really know. It
yeah,
looks good. I've seen it. I've heard about it. Sounds good for other people, but we don't actually know if it's relevant to that person. And that's what your job is. And the job of Exercise Phys is to make sure that people are doing the right things in a way that sets them up for success, feels good, is enjoyable, no stigma attached.
yeah. Personally, I think that the way that we do change that is creating available information resources that allows us to kind of provide general information that at least targets that, okay, if I don't fall into this category, then I probably need more specific information. If I do fall into this category, and I do feel like I can do this safely, then these are the exercises that I can start with. And I think that's probably how we change that access in regional and community areas, is everyone has to start somewhere. And can we create a toolkit that allows people to make those educated choices themselves, more like a buffer, or I guess a sieve, to shift the overwhelming amount of information to a funnel effect that then goes, okay, well, if I don't fall into this category, or I have more questions, then I probably do need to seek more individualized and specific exercise information. For most people, it's just, what am I doing right now? And how does that make me feel? Whether that's too much exercise, or most of the population is under exercising. And how can I just get a little bit more in?
Yeah, that's awesome, Shannan. Thanks so much for your time today.
Thank you for having me.
Really appreciate the chat. Is there anything that we didn't talk about today that you'd like to mention before we wrap up?
Not specifically. I think we've covered a fairly broad topic in terms of exercise. I think the one thing that I often tell people is I really don't care what type of exercise. There are gold standards that we will recommend. But if people are doing something, that's the best place to start. But it is about being aware that you don't need to have the answers. That's what we're here for. That's what our job is. And making it a little bit more okay to ask those questions, and then knowing that you're coming into spaces where our job is to help you feel more confident. That's probably the message that is most important, is exercise should be enjoyable. And if it's enjoyable and you feel confident, you're more likely to do it.
That's amazing. As you were talking, I had one more question actually. Is it a matter of just going to premises like yours and saying, hey, I'd like to show up and have a session? Do you need a doctor's referral? What's the best way to, once you find an exercise physiologist near you, how do you go about connecting with them?
Absolutely. All exercise physiologists, especially if they are accredited, you're able to access them privately. You can just walk in the door, same as you would see a personal trainer. From there, access to them depends on whether you would like to pay privately. Private health insurance does cover access to exercise physiologists as long as it is specified. Unfortunately, the word physio and physiologist is quite similar. So people do often think that they have physiologist cover, but it's actually physiotherapy, which they are also equipped to provide exercise advice, maybe not as specific as us, but they can then pass you in that direction. From there, you can get a doctor's referral, especially if you do have chronic health conditions. They do provide those for exercise physiology for the purpose of exercise prescription to manage chronic health conditions. Essentially, then we will then guide exercise based on, do you need to see us specifically, or can we provide our personal trainers with the information and a program to then be facilitated by them? That's generally how most people access it. Other funding streams are available depending on individual circumstances, but for most people, it's come in the door.
Amazing. One less barrier, making it easier to get help right away.
Absolutely. And that's the key, is making sure that it is as accessible as possible.
Thanks so much for your time, Shannan. Really appreciate your expertise and sharing your thoughts and your passion for helping women in regional areas. It's really amazing what you're doing, and I hope we see more of this.
Same. I do hope it becomes much more readily available, but also something that we're talking about much more frequently. Thank you very much for having me.
Pleasure. We'll see you next time.